CEN Exam Prep in India. Question 1. A patient with anorexia nervosa presents with significant electrolyte abnormalities. Which electrolyte finding is most concerning? Option A, hypokalemia. Option B, hyponatremia. Option C, hyperkalemia. Option D, hypercalcemia. The correct answer is option A, hypokalemia. Hypokalemia is the most common and concerning electrolyte abnormality in anorexia nervosa, particularly related to purging behaviors. It can lead to cardiac arrhythmias, weakness, and QT prolongation. Hyponatremia, B, can occur but is less common. Hyperkalemia, C, is not typical of anorexia. Hypercalcemia, D, is not associated. Question 2. Which laboratory finding is most specific for acute myocardial infarction? Option A, elevated creatine kinase -MB, CK-MB. Option B, elevated troponin I. Option C, elevated myoglobin. Option D, elevated C-reactive protein. The correct answer is option B, elevated troponin I. Cardiac troponins, troponin I and T, are the most specific biomarkers for myocardial injury because they are found exclusively in cardiac muscle. Troponin I is not found in skeletal muscle, making it highly specific for myocardial infarction. CK-MB, A, is elevated in cardiac injury but can also be elevated with skeletal muscle damage. Myoglobin, C, is early but nonspecific. CRP, D, is a marker of inflammation and is not specific for me. Question 3. A patient presents with acute kidney injury. Which laboratory finding is most consistent with prerenal azotemia? Option A, BUN/CR ratio 20:1. Option B, BUN/CR ratio 10:1. Option C, normal BUN/CR ratio. Option D, elevated CR with normal BUN. The correct answer is option A, BUN/CR ratio 20:1. In prerenal azotemia, decreased renal perfusion, the BUN/CR ratio is typically 20:1 due to increased reabsorption of urea. In intrinsic renal disease, the ratio is typically 10:1. B. Normal ratio, C, and elevated CR only, D, are not characteristic of prerenal azotemia. Stressed about your CEN exam? We can take CEN exam for you remotely and undetected. We always guarantee a pass and payments only after results. To send us an email, scan the code or tap the link in the description and let's get it done. Question 4. A patient is brought in with suspected carbon monoxide poisoning. What is the most important diagnostic finding? Option A, carboxyhemoglobin level. Option B, ABG with PAO2. Option C, methemoglobin level. Option D, white blood cell count. The correct answer is option A, carboxyhemoglobin level. Carboxyhemoglobin, COHB, level is diagnostic for carbon monoxide poisoning. ABG PAO2, B, may be normal despite severe hypoxia because co-binds to hemoglobin. Methemoglobin, C, is seen with other toxic exposures. WBC, D, is nonspecific. Question 5. A patient with a history of alcohol use disorder presents with confusion, ataxia, and ophthalmoplegia. What is the most likely diagnosis? Option A, Wernicke-Korsakoff syndrome. Option B, delirium tremens. Option C, alcoholic ketoacidosis. Option D, hepatic encephalopathy. The correct answer is option A, Wernicke-Korsakoff syndrome. Wernicke-Korsakoff syndrome presents with the triad of confusion, ataxia, and ophthalmoplegia, caused by thiamine deficiency due to chronic alcohol use. Delirium tremens, B, presents with tremor, agitation, and hallucinations. Alcoholic ketoacidosis, C, presents with metabolic acidosis. Hepatic encephalopathy, D, presents with altered mental status due to liver failure. Question 6. A patient with suspected stroke has a blood pressure of 190/110 mmHg. What is the appropriate nursing action? Option A, administer 4-labetalol to lower blood pressure. Option B, administer 4-hydralazine. Option C, allow blood pressure to remain elevated unless there are signs of end-organ damage. Option D, administer a nitroprusside drip. The correct answer is option C. Allow blood pressure to remain elevated unless there are signs of end-organ damage. In ischemic stroke, elevated blood pressure is often compensatory to maintain cerebral perfusion to penumbral tissue. Current guidelines recommend against lowering blood pressure unless it is extremely high, greater than or equal to 220/120, or the patient is receiving thrombolytics. This patient does not qualify for intervention yet. Options A, B, and D are not recommended unless criteria are met. Question 7. A patient with suspected renal colic has a temperature of 101 degrees Fahrenheit. What is the priority nursing action? Option A, administer for pain medication. Option B, obtain a urine sample. Option C, notify the provider immediately. Option D, administer antiemetics. The correct answer is option C. Notify the provider immediately. Fever in a patient with renal colic suggests a superimposed infection, which can rapidly progress to urosepsis. The provider should be notified immediately so antibiotics can be initiated. While pain medication, A, is important, the infection needs to be treated promptly to prevent sepsis. Question 8. A patient with severe asthma exacerbation has a peak expiratory flow rate, PEFR, of 35% of personal best. Which treatment should the nurse anticipate? Option A, continuous nebulized albuterol. Option B, oral corticosteroids. Option C, 4-magnesium sulfate. Option D, immediate intubation. The correct answer is option A, continuous nebulized albuterol. PEFR below 50% indicates a severe exacerbation requiring aggressive bronchodilation. Continuous nebulized albuterol is indicated for severe asthma. Oral corticosteroids, B, should also be given but are not the immediate treatment. 4-magnesium, C, may be used for refractory cases. Intubation, D, is for impending respiratory failure with altered mental status, exhaustion, or hypercapnia.
Are you looking for Colorado real estate actual questions? Visit our website pokerexams.com to access Colorado Real Estate Study Guide with actual questions and answers. Scan the QR code or click the link in the description to get Colorado Real Estate Answer Key today.
Question 9. A patient with a dog bite to the hand presents 48 hours later with redness, swelling, and purulent discharge. What is the most likely causative organism? Option A, Staphylococcus aureus. Option B, Pasteurella multocida. Option C, Streptococcus pyogenes. Option D, Vichnella corrodens. The correct answer is option B, Pasteurella multocida. Pasteurella multocida is the most common organism isolated from dog and cat bite wounds. It typically causes infection that appears within 24–48 hours with purulent drainage. Staphylococcus aureus, A, and Streptococcus pyogenes, C, are also common but less specific to animal bites. Vichnella corrodens, D, is associated with human bites. Question 10. A patient with a known history of type 1 diabetes presents with nausea, vomiting, and a blood glucose of 450 mg/dl. ABG shows pH 7.15, HCO3 12 milliequivalent/L. What is the priority intervention? Option A, administer regular insulin 4. Option B, administer 4 fluids. Option C, administer potassium. Option D, obtain a urine ketone test. The correct answer is option B, administer 4 fluids. In DKA, fluid resuscitation is the first priority to correct dehydration and improve perfusion. Insulin, A, is given after fluids. Potassium, C, is given after the patient is rehydrated and potassium is monitored. Urine ketones, D, are important but not the priority. Question 11. A patient is brought to the ED after a witnessed seizure lasting 8 minutes. What is the priority nursing action? Option A, administer 4 lorazepam. Option B, assess for head injury. Option C, obtain a stat CT scan. Option D, perform a detailed neurological assessment. The correct answer is option A, administer 4 lorazepam. A seizure lasting more than 5 minutes is status epilepticus, a neurologic emergency. The priority is to terminate the seizure with benzodiazepines, lorazepam or diazepam. While head injury assessment, B, and CT, C, are important, the seizure must be stopped first. A full neuroassessment, D, will be performed after the seizure terminates. Question 12. Which symptom is most characteristic of a subarachnoid hemorrhage? Option A, sudden, severe thunderclap headache. Option B, gradual onset of confusion. Option C, focal weakness on one side. Option D, loss of consciousness without headache. The correct answer is option A, sudden, severe thunderclap headache. Subarachnoid hemorrhage classically presents with a sudden, explosive thunderclap headache described as the worst headache of the patient's life. Focal weakness, C, is more common in ischemic stroke. Gradual confusion, B, is less characteristic. Loss of consciousness without headache, D, is not typical. Question 13. A patient presents with acute pelvic pain, fever, and cervical motion tenderness, chandelier sign. What is the most likely diagnosis? Option A, ectopic pregnancy. Option B, ovarian torsion. Option C, pelvic inflammatory disease. Option D, appendicitis. The correct answer is option C, pelvic inflammatory disease. The classic triad of PID is pelvic pain, fever, and cervical motion tenderness, chandelier sign on bimanual exam. Ectopic pregnancy, A, would present with pain and bleeding but often no fever. Ovarian torsion, B, presents with sudden, severe unilateral pain without cervical tenderness. Appendicitis, D, presents with right lower quadrant pain. Question 14. A patient presents with signs of sepsis. Which of the following is the most important early intervention? Option A, administer broad-spectrum antibiotics. Option B, administer 4 fluids. Option C, obtain blood cultures. Option D, start a vasopressor. The correct answer is option C, obtain blood cultures. In sepsis, blood cultures should be obtained before starting antibiotics to identify the causative organism. Antibiotics, A, should be given as soon as possible but after cultures. 4 fluids, B, are given simultaneously with cultures. Vasopressors, D, are started after fluid resuscitation. Question 15. A patient with cirrhosis presents with hematmesis. What is the most likely source of bleeding? Option A, peptic ulcer. Option B, esophageal varices. Option C, gastritis. Option D, a Mallory-Weiss-Tear. The correct answer is option B, esophageal varices. Patients with cirrhosis develop portal hypertension, leading to esophageal varices. These are fragile and prone to bleeding, causing hematmesis. While peptic ulcers, A, gastritis, C, and Mallory-Weiss-Tears, D, can also cause upper GI bleeding, esophageal varices are the most likely source in a patient with cirrhosis. Question 16. A patient is experiencing a tension pneumothorax following chest trauma. The nurse anticipates which intervention? Option A, needle decompression at the second intercostal space, midclavicular line. Option B, needle decompression at the fifth intercostal space, anterior axillary line. Option C, chest tube insertion at the second intercostal space, midclavicular line. Option D, supplemental oxygen and observation. The correct answer is option A, needle decompression at the second intercostal space, midclavicular line. Tension pneumothorax is a life-threatening condition requiring immediate needle decompression. The needle should be inserted at the second intercostal space in the midclavicular line on the affected side. This releases trapped air and relieves pressure on the heart and great vessels. The fifth intercostal space, B, is for chest tube insertion. Chest tube insertion, C, is the definitive treatment after needle decompression. Question 17. A patient presents with cough-ground emesis and melena. What is the priority nursing action? Option A, administer 4 fluids. Option B, insert a nasogastric tube. Option C, prepare for blood transfusion. Option D, assess airway and breathing. The correct answer is option D, assess airway and breathing. The ABCs take priority. Cough-ground emesis and melena indicate an upper GI bleed. The patient is at risk for aspiration and hypovolemic shock. Airway assessment and breathing are the first steps. For fluids, A, blood transfusion, C, and ing tube insertion, B, are important but secondary to airway assessment. Question 18. The nurse is caring for a patient who has been diagnosed with an advanced end-stage cancer. The medical team has suggested palliative care and hospice. Which of the following statements would be appropriate for the nurse to make when explaining the suggestion to the patient's family? Option A. Palliative care begins with the initial diagnosis and continues through the end of life. Option B. The patient cannot change their end-of-life decisions once enrolled in hospice. Option C. There is an important legal distinction between withholding care and withdrawing care. Option D. A living will names a person to make medical decisions if the patient is unable to do so. The correct answer is option A. Palliative care begins with the initial diagnosis and continues through the end of life. Palliative care is appropriate at any stage of a serious illness, starting at diagnosis, and can be provided alongside curative treatment. It is not limited to end of life. Hospice is one type of palliative care for end of life. Patients can leave hospice at any time. B. Withholding and withdrawing care, C, are not what is being explained. A living will, D, is a legal document specifying treatment wishes, while a healthcare proxy names a decision-maker.
Stressed about your Colorado real estate? We can take Colorado real estate for you remotely and undetected. We always guarantee a pass and payments only after results. To send us an email, scan the code or tap the link in the description and let's get it done.
Question 19. The nurse is triaging a child complaining of fever and rash for 3 days. The nurse notices the appearance of blue-gray spots with a red base on the inside of the child's mouth and a maculopapular rash on the face. Where would be the best location for this patient following triage? Option A. Return to the waiting room in line of sight of the triage nurse. Option B. Resuscitation bay to prepare for intubation. Option C. Isolation room on droplet precautions. Option D. Isolation room on airborne precautions. The correct answer is option D. Isolation room on airborne precautions. The child's symptoms, colic spots, blue-gray spots with a red base on the buccal mucosa, and maculopapular rash, are classic for measles, rubella. Measles is transmitted by airborne particles and requires airborne precautions with N95 mask and negative pressure isolation. Droplet precautions, C, are not sufficient. Question 20. A patient presents with heat stroke. What is the priority nursing intervention? Option A. Administer antipyretics. Option B. Rapid cooling with cold water immersion. Option C. Administer 4 fluids. Option D. Obtain a core temperature. The correct answer is option B. Rapid cooling with cold water immersion. Heat stroke is a life-threatening emergency requiring rapid cooling. Cold water immersion is the most effective method. Antipyretics, A, are not effective for heat stroke, as the elevated temperature is from environmental exposure, not a reset hypothalamic set point. For fluids, C, are important but cooling is the priority. Obtaining core temperature, D, is important but should not delay cooling. Question 21. An epidural hematoma is most commonly associated with which mechanism of injury? Option A. Striking the head on a hard surface. Option B. Rapid deceleration injury. Option C. Injury to the temporal bone with laceration of the middle meningeal artery. Option D. Acceleration-deceleration injury causing shearing forces. The correct answer is option C. Injury to the temporal bone with laceration of the middle meningeal artery. Epidural hematoma is typically caused by a blow to the temporal area of the skull, lacerating the middle meningeal artery. This results in rapid accumulation of arterial blood. Option A is too general. Option B describes diffuse axonal injury. Option D describes subdural hematoma. Question 22. A patient's ABG results show pH 7.25, PaCO 255 mmHg, HCO 324 milliequivalent/L. What is the most likely interpretation? Option A. Metabolic acidosis. Option B. Metabolic alkalosis. Option C. Respiratory acidosis. Option D. Respiratory alkalosis. The correct answer is option C. Respiratory acidosis. The ABG shows a low pH, acidemia, elevated PaCO2, greater than 45 mmHg, and normal HCO3. This is consistent with acute respiratory acidosis from hypoventilation. Metabolic acidosis, A, would show a low HCO3. Metabolic alkalosis, B, would show elevated pH and HCO3. Respiratory alkalosis, D, would show low PaCO2. Question 23. A patient presents with signs of hypothermia. Which core temperature indicates severe hypothermia? Option A, 32 degrees Celsius. Option B, 30 degrees Celsius. Option C, 28 degrees Celsius. Option D, 26 degrees Celsius. The correct answer is option C, 28 degrees Celsius. Severe hypothermia is defined as a core temperature below 28 degrees Celsius (82.4 degrees Fahrenheit). At this temperature, the patient may be unconscious with minimal or absent vital signs. Mild hypothermia, 32-35 degrees Celsius, A, moderate, 28-32 degrees Celsius, B, and severe, 28 degrees Celsius, C. Option D, 26 degrees Celsius, is also severe, but 28 degrees Celsius is the threshold. Question 24. A patient arrives with a chief complaint of the worst headache of my life. Which of the following is the priority nursing action? Option A, administer pain medication. Option B, perform a neurological assessment. Option C, prepare the patient for a CT scan. Option D, establish for access. The correct answer is option C. Prepare the patient for a CT scan. Worst headache of my life is a classic presentation for subarachnoid hemorrhage. A non-contrast CT scan is the priority diagnostic test. While neuroassessment, B, is important, the CT is diagnostic and should not be delayed. Pain medication, A, and for access, D, are important but secondary to diagnosis. Question 25. A patient is diagnosed with acute appendicitis. The nurse is particularly concerned if the patient reports which symptom. Option A, sudden relief of pain. Option B, nausea and vomiting. Option C, right lower quadrant pain. Option D, rebound tenderness. The correct answer is option A, sudden relief of pain. Sudden relief of pain in a patient with suspected appendicitis may indicate perforation of the appendix. This is a serious complication requiring immediate surgical intervention. Nausea and vomiting, B, right lower quadrant pain, C, and rebound tenderness, D, are all expected findings in appendicitis.